Hello everyone, welcome back to MJ Pharma. Today we're diving into a rare genetic disorder called Wilson disease. Wilson disease is a rare genetic disorder where your body struggles to eliminate excess copper, leading to its accumulation in organs like the liver, brain, and eyes. Although copper is essential in small amounts, too much can be toxic. The root cause lies in an inherited defect in the ATP7B gene, passed down from both parents. Carriers might not show symptoms, making it challenging to predict. Symptoms vary and can manifest anytime between ages 5 and 35. Liver symptoms include fatigue, nausea, and yellowing of the skin. Neurological symptoms may involve tremors, stiffness, or changes in behavior. Diagnosing Wilson disease can be tricky. Eye exams, blood tests, and genetic testing are crucial for confirmation. Kayser-Fleischer rings in the eyes are a notable sign. Now, let's talk about treatment. Lifelong management involves a low-copper diet, minimizing copper intake from foods like shellfish, liver, chocolate, and certain nuts. Zinc supplements can help block copper absorption, as zinc is readily absorbed. Chelating agents like penicillamine and trientine are also used. These medications remove excess copper from the body, preventing its harmful buildup. Complications include liver damage, inflammation, and even liver failure. Neurological symptoms can affect daily functioning and, in rare cases, lead to fatal outcomes. Genetic counseling can help assess the risk for Wilson disease in families. There's no prevention, but early detection and treatment are key. And there you have it, a brief overview of Wilson disease. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more health-related content.